I'm Dr. Michael Shingles. I'm a team physician here at Michigan State University, and I'm a professor at Michigan State College Osteopathic Medicine. I went to high school here in Michigan at Berkeley High School, and then went to my undergraduate at University of Michigan. Eventually got to Michigan State for medical school, and went to Chicago for training in my orthopedic residency. Came back here to Michigan State for a fellowship in sports medicine, and I've been here ever since. I've been here at Michigan State since 2000-2001. My main responsibilities are with men's and women's basketball here at Michigan State, and I also work with MSU football, but with my partners we cover all athletics here at Michigan State. My main interest in research at this current time is ACL prevention, and we're starting a number of programs in order to see how we can decrease the number of injuries in our athletes as far as ACL injuries are concerned. I work with a lot of the high school athletes outside of Michigan State in the greater Lansing area, and also schools from up north, down south, and both on the west and east sides of us as well. I am the team physician for East Lansing High School, and I've been doing that since probably 2004, maybe 2003, and enjoy taking care of our high school athletes here in the community. I teach at the medical school for the first and second years regarding basic orthopedic knowledge. I also have medical students of all years rotate through here at our clinic in order to learn sports medicine and orthopedics. And finally, I'm highly involved in the orthopedic residency program here at Michigan State as well. Here at Michigan State, we currently have a primary care sports medicine fellowship. We usually take 2 primary care physicians to rotate with us here at Michigan State University, and they rotate with me regarding sports medicine and orthopedics here in the clinic and then on the field as well. As an orthopedic surgeon, I'm trained to take care of joints and bone injuries. You can do that either through conservative treatment or surgical treatment. As an orthopedic surgeon, we do both. And I do a fair amount of trauma as an orthopedic surgeon, whether it's on call in the community, and I enjoy that part of my practice, being able to take care of emergencies and fractures. That's usually with a trauma situation on call, but also our athletes often have fractures as well. So keeping involved in the community and doing trauma work helps me take care of our athletes. That's one of the reasons I continue to do it. My true passion is to do sports medicine. I was trained an additional year in sports medicine orthopedic surgery. Basically, that lets me take care of pretty much any array of sports injuries that involve joints, muscles, bones. Majority of my practice involves knee injuries. I see quite a few complex knee injuries from around the state, and I enjoy that challenge. Most of it's fairly routine, but some of them can be more challenging, and that's where a large part of my practice focuses on. I also take care of course, shoulder, ankle, hip, elbows. Shoulders probably being the second most common thing I see here in the practice. I do take care of hips as well. In patients, usually I limit my hip practice to athletes, where it's a huge benefit what we can do now with hip arthroscopy and hip procedures. As a sports medicine physician and an orthopedic surgeon, my goal is to not only take care of the patient's or athlete's joint that they've injured or bone, but also to get back to their sport. And return to play is a major issue here and important to a lot of athletes and patients. They want to get back, and they want to get back safely but quickly. So the experience we've learned here at Michigan State taking care of our athletes over since 2001 allows me to use my knowledge to help my athletes make decisions about returning back to sport and when it's safe and when they can take some risks to return back in order to optimize their performance and lengthen their careers or activities. Take care of athletes from age 3 all the way up to 85. I did a video in the past and said my athletes are 65, and I had some of my patients that are older than that got angry at me because they're still into their sports, sometimes well into their 80s, and I think being active is important, and having something you have a passion about increases your quality of life. And so That's the part I enjoy about sports medicine.